Many people experience skin problems like acne or eczema. So, can you elaborate on the connection between these issues and gut health?
Yes, as I told you before, now let me explain that what decides the microbiome. So, when a child is born by 5 to 6 years of age, all the bacteria or whatever microorganisms we have, the microbiome of an individual is decided according to their genetics, according to their mode of birth, and so on and so forth. But as we grow older, what kind of diet we are eating, what kind of lifestyle we are living, and whether we are constantly on antibiotics or we are always on some medicines like antacids, for example, or people who are going cancer chemotherapy. So all these things have a very adverse effect on our gut health because they disrupt the normally existing bacteria which are there. And due to this, it might affect the distant organs, and skin is one of them. So what happens is that these tiny microorganisms, they have a very crucial role and a very pivotal role because they decide the immune regulation. They are responsible for building the immunity in initial years, and they are responsible for anti-inflammatory effects. They produce several very useful anti-inflammatory substances in our gut. So what happens is any disruption in this environment of the gut, it will lead to the increased inflammation, and so we can notice there can be flare of acne if you have some disruption in the gut. For example, if you have diarrhea, you are on antibiotics, not only you have diarrhea, it can flare your acne. And still the research is going on, but there are several other diseases which are implicated because as the inflammation increases, people who have eczema will notice the flare. People with psoriasis will suddenly notice that the psoriasis is worsened. So if you want to maintain healthy skin, you have to maintain good gut health.